Welcome, everyone. Today, we delve into the world of medicine and explore central serous chorioretinopathy, or CSCR for short. This condition, often simply called central serous, is an eye disorder that primarily affects the central vision. It's characterized by fluid buildup under the retina, which distorts vision and can lead to a significant reduction in visual acuity. The pathophysiology of CSCR involves a complex interplay of factors, including stress, steroid use, and certain genetic predispositions. Although several treatment options exist, such as laser therapy and medication, they often come with their own limitations, and not all patients respond favorably. Furthermore, they can sometimes lead to adverse side effects, adding another layer of complexity to the management of this condition. The impact of CSCR on patients' lives underscores the need for more effective treatments, which brings us to a potentially novel approach, Rifampicin. Before we dive into its potential use in CSCR, let's understand Rifampicin. Rifampicin is a potent antibiotic that has been around for decades. Its primary function: to wage war against bacteria in our bodies. The way it works is fascinating. Rifampicin has a knack for infiltrating bacterial cells and binding itself to an enzyme called DNA-dependent RNA polymerase. This enzyme is crucial for bacteria, as it transcribes DNA into RNA, a key step in protein synthesis. By latching onto this enzyme, rifampicin obstructs the transcription process, effectively halting the bacteria's ability to reproduce or carry out essential functions. Traditionally, rifampicin has been a cornerstone in the treatment of tuberculosis, a severe lung infection caused by the bacterium Mycobacterium tuberculosis. It's also been used against other bacterial infections such as leprosy and Legionnaire's disease. Now that we've established an understanding of rifampicin, it's time to explore its potential role in treating CSCR. The question arises, why rifampicin for CSCR? Well, the theoretical basis for using rifampicin in CSCR is rooted in its unique properties. It's not just an antibiotic, but also has anti-inflammatory and anti-angiogenic effects. Let's start with the anti-inflammatory part. Inflammation is a common feature in CSCR, and rifampicin, known for its potent anti-inflammatory properties, can potentially help in dialing down this inflammatory response. Now onto the anti-angiogenic effects. Angiogenesis, or the formation of new blood vessels, is a key player in the pathogenesis of CSCR. Rifampicin is thought to inhibit this process, thereby reducing the subretinal fluid accumulation that leads to vision loss in CSCR patients. It's like hitting two birds with one stone, tackling both inflammation and angiogenesis, which are core elements of CSCR pathogenesis. But you might be wondering, does this theory hold water? So does the theory translate into practice? Let's look at some clinical studies. Several clinical studies have investigated the potential of oral rifampicin in treating CSCR. Now let's delve into some of the key studies that have paved the way for this novel therapeutic approach. One of the most notable studies was conducted over a 12-month period, where patients with chronic CSCR were administered a daily dose of rifampicin. The study design was quite robust, involving a series of checks and balances to ensure the accuracy of the results. The findings were promising. A significant majority of the participants showed a marked reduction in subretinal fluid, a common symptom of CSCR, and an improvement in visual acuity. This is a big deal, as these are the primary indicators of successful CSCR treatment. In another study, researchers went a step further to investigate the long-term effects of rifampicin. The participants were monitored for an extended period of 24 months. The outcomes were similar to the first study, but with an added bonus. Not only did the patients experience a decrease in subretinal fluid and better visual acuity, but they also reported sustained benefits. This suggests that rifampicin could potentially offer long-term relief, a feat that current treatment options have struggled to achieve. There was also a comparative study that pitted rifampicin against the traditional treatment modalities. The goal was to directly compare the effectiveness of rifampicin with the standard treatments. The results? Rifampicin held its own, showing comparable if not better results. This is an encouraging sign, indicating that rifampicin could be a viable alternative for patients who do not respond well to traditional treatments. However, it's important to note that while these studies are promising, more extensive research is needed to conclusively establish the effectiveness of rifampicin in treating CSCR. After all, the medical field thrives on thorough investigation and evidence-based practices. These studies suggest that rifampicin may indeed be effective, but how does it compare with traditional treatments? Let's find out in the next section. Efficacy is one thing, but how safe is oral rifampicin for CSCR patients? Well, let's delve into this. Studies have shown that oral rifampicin can be effective in resolving subretinal fluid and improving visual outcomes in CSCR patients. This is a notable breakthrough considering the limitations of traditional treatment modalities. Now on to the safety profile. Like any medication, oral rifampicin does have side effects. Common ones include gastrointestinal issues like nausea and occasionally changes in liver function tests. However, these side effects are typically manageable and reversible upon discontinuation of the drug. Importantly, regular monitoring and management strategies can mitigate these risks. For instance, liver function tests should be conducted before starting treatment and periodically thereafter. In conclusion, while the efficacy of oral rifampicin in treating CSCR is promising, it's not without its challenges. While rifampicin shows promise, patient selection and monitoring are crucial. This ensures that the benefits outweigh the potential risks, enhancing patient safety and treatment outcomes. Not every CSCR patient may be suitable for rifampicin therapy. It's essential to consider the patient's overall health, existing conditions, and potential drug interactions. Once treatment starts, close monitoring is crucial. Regularly checking liver function, watching for changes in vision, and assessing symptom improvement are all part of this process. Remember, the aim is to improve the patient's visual outcome while minimizing potential side effects. Rifampicin thus offers a promising alternative in the management of CSCR. As we wrap up, let's revisit the key points. We've delved into central serous chorioretinopathy and the promising role of oral rifampicin as a novel treatment. We've discussed its anti-inflammatory and anti-angiogenic properties and the encouraging results from clinical studies. Yet it's crucial to remember the need for careful patient selection and vigilant monitoring. As we look to the future, more research is needed to fully unlock this therapy's potential and optimize its use. Until next time, keep exploring, keep learning.